So I guess we can start with a call for a motion to open the meeting on February 1st, 2022 at 5:32 p.m.
I will make a motion to start the meeting on February 1st, 2022 at 5:34 p.m.
I second that motion. All in favor? Yes. Maggie?
Beth, yes.
You want to
Do we want to do a roll call or attendance, whatever it is? Maggie Hebert
here?
And Beth Rist
Here.
Okay.
And just make a record that Amy
absent.
Yeah. Just in accordance with the Mass General Law, we just need to let everyone know who's in attendance that this meeting is being recorded and no one else should be recording this meeting, either audio or video. Just some ground rules for any time anyone is speaking. You must direct your conversation towards the board. No interruptions from the public. If you want to speak, you can. Are we going to have people raise their hand, Bree, or no? Okay. And this is just in response to anything on the agenda. That's it. So we can get started with the first agenda item, which is Megan Harvey and a COVID-19 update.
Yeah, hi everyone. Thanks for having me back. I didn't prepare slides this time because the dashboard just went out, and I thought we could, if we need to, we could refer back to some of the visuals that were posted with the dashboard this week. There's not much that has changed in terms of what we understand about Omicron or the variant. The big change that we are seeing, of course, is that our rates are declining at this point in Easthampton. They're still quite high, of course, to have something like 180 cases per day per 100,000 is higher than we've had in the past. And, but we're on it would appear genuinely on the other side of that slide down. So that's great news. The question we have is how long that slide down will take. If we look to other locations that have been through this, it looks like a pretty sharp decline and then a plateau at some point. So we'll have to see. Hopefully the high vaccination rates in Easthampton mean that plateau will still be at a very low level. If we hit that, we do have higher rates in Easthampton than in the country as a whole. So that helps us. I did include information this week on our vaccination rates by age group and by race ethnicity subgroup. And we do see some disparities, most particularly among our youngest kids and 20 to 29-year-olds. And then we do see lower vaccination rates among Hispanic and Black folks in our community. Really it's sort of, for a surge, it's sort of been business as usual for a little bit in terms of things changing. There has been an update of that other variant, that mutation of the Omicron mutation that they're calling BA2. It is becoming dominant in some locations, or at least on its way to becoming dominant, but it does not appear to behave differently than it's in the sublineage from BA1 or the Omicron that we're familiar with. So if anything, I think that's probably part of this slow decline / plateau that we're seeing. I don't see any reason that we would expect anything different here in Easthampton. So that's sort of what I see coming. Yeah.
Can you, Megan, just briefly go over, I have to open it, but one of the things you sent us was a chart in the percentage or amount of deaths with vaccinated, booster, and non-vaccinated. Any comment on that or?
Yeah, the vaccine topic is, I know, so heated for folks, and there's all sorts of, various feelings about, if it's worth it and what the cost benefit analysis is. But the facts from what's happening in our hospitals right now are really clear. So there's definitely an advantage in terms of infection. If you are vaccinated with the full initial series, so the 2 doses of the mRNA or the single Johnson & Johnson, you have a lower risk of infection. That drops a lot if you have the booster dose. And then we really see a big benefit in terms of severe outcome. So even greater benefit than just getting infected. So those who are seriously ill and those who are dying, unfortunately, we have super high rates of both of those in the US right now. That is by and large folks who are unvaccinated, which is really, I think, part of the trauma, I think, for healthcare workers. I'm looking over to Bridget. She can probably confirm. My sense is it's really traumatic inside the hospitals right now for so many folks to be dying of a essentially preventable disease at this point, or at least the severe outcomes are mostly preventable.
And I'm only asking because some people have asked me. A lot of people, I'm not sure where they're getting their information, but they feel that if they tested positive, that they have a natural immunity. Just for the sake of, we do have some people from the public attending tonight. Would you be able to explain, is that true? Is it not true? What does that mean?
Yeah, it's definitely true that having been infected provides some level of immunity. However, when you go in and compare the levels of immunity that we can measure, things like antibodies, we see higher levels of antibodies with vaccine immunity than with, quote, natural immunity from an infection. That doesn't mean that that's the only part of immunity that matters. There's also T cells and memory cells and a whole thing. So if we look at real world data, of what actually happens among folks who have been infected but have no other vaccination on record versus folks who are vaccinated and have an infection that they've recovered from. We see far higher rates of immunity, of protection from serious outcomes among those who are vaccinated and have natural infection. And in fact, folks in the community are sort of thinking about this additional, the fact that you've been through an infection and your system has cleared it, it's almost like another booster dose. And so folks who have gone through the full series, the 2-dose mRNA or the Johnson & Johnson, who have had a booster and who have also had an infection at some point, at this point have a very high level of protection against whatever is coming next. And it seems to be the variety and like the types of protection that's providing the excess levels of protection. So the fact that one was an Omicron, one was an mRNA, and if you got something different for your booster, the variety seems to really help our immune system. So that's my long answer. The short answer is that natural immunity is good and is real, but is really greatly benefited by vaccine immunity.
Okay. So best case scenario, you get all the vaccines, then you have a mild case of COVID.
Yeah. You don't even know you have it. You test positive, you stay home, you recover in 5 days, or you're allowed back out in 5 days, and then you're really can feel very comfortable. And the way I wrote the dashboard this week, I really wanted, I know there's, unfortunately, the people who are most protected and who are most cautious are often the people who are most nervous about getting infected and getting a severe outcome. And I was trying to really reassure those who are vaccinated and have a booster, with or without some additional natural infection, natural immunity, but at this point, they're really well protected from a severe outcome.
Can I say something?
Yes.
I think also I've noticed from my patients, they think they had COVID in I literally had a patient tell me she had COVID in 2020, I think. And so she doesn't need a vaccine. But the reality is you can get COVID multiple times. So even if you've had it before, it doesn't protect you forever. So that's the other piece of it. Vaccine's the best thing you can do.
Right. Even if you've had it. Yep.
Yeah.
Maggie, I have a question for Megan, if you don't mind.
Yeah, go ahead, Bree.
So I don't know if you have seen any studies around this, but we kind of saw the same trajectory last year where we had our increase in December, which was nowhere near our increase this year, and January, and then we kind of came down. The summer was pretty much zero. I remember we stopped the dashboard because there was literally nothing to report.
Yeah.
And then it increased again in August. Are we going to see this? I mean, our world's going to be flipped upside down every August because do you know anything about long term?
Yeah, that's like the $1 million question right now. There's a couple of ways that folks are thinking about what endemic COVID will look like. It's clear that it's going to be endemic at some point. And what that means is that we won't see these super high surges that stress the healthcare system, but that if we see surges, they're smaller on the scale of what we see with like influenza. So influenza is endemic every couple of years, not every couple of years, every once in a while, we have a more severe strain that does cause an epidemic or a pandemic. But most years, the surge that we see during flu season is within our capability to handle. And that's really the part that we're waiting to figure out how we get to that. So I'm sure, and I don't know if like flu, it will be seasonal. There's some indication that it's actually not seasonal. And so for us, it happens to coincide with the winter, but in other areas of the world, you know, it's summer and they're having their surge, unlike the flu. So whether it will always coincide with flu season, I don't know. But the question is, how do we get to a point where that surge does not overwhelm the hospitals? I don't know. In other words, our next surge might still be tough when it comes, but I think the level of protection that we're going to get from this surge will at least give us several months of calm between.
Thank you.
Yeah. And the unfortunate reality is that the folks who are going to be most impacted in any of these future surges are the folks who are unvaccinated. So it will continue to sort of be, I hate to call it a pandemic of the unvaccinated because it just sounds divisive, but I think it really does highlight the fact that those are the folks who are suffering the most severe outcomes, and who we really want to protect.
Bridget, do you have anything to add?
I can unmute you if you want.
No, I don't have anything to add. I think Megan really highlighted everything very well. So thank you for that, Megan.
Yeah, thanks, Megan. I just, your wealth of knowledge just really helps me to stay focused on what we're doing and how it's going. So thank you.
You're welcome.
Thank you.
All right. So I think that's the only thing on the agenda except for our health director general update.
And I just realized I forgot to put the minutes, approve the minutes. on the agenda. So we'll do it at the next meeting.
Okay. For Jack.
I went through, Jackie, I know, she worked so hard to get them done and then it's not even on the agenda, but they're done for next time. So I just have a couple of things. We scheduled a vaccine clinic on February 16th at the new Mountain View School. So we're excited, you know, quite honestly, just to get into that school and utilize that space. So it's going to be open. We're doing a 12 plus from 1:30 to 3:30. So we'll be able to get the 12 plus population that's in school done right when they're in school. So it will be nice and easy for them. And then the 5 to 11 population will be from 4 to 5:30 because that age group just typically needs their parents to accompany them, but it is open to the public, the 12 plus. So we can have adults there. It's not just for the school population. And we're doing everything from first doses to boosters to whatever people are eligible for. It will just be Moderna and Pfizer.
And is that clinic just for Easthampton citizens or open to?
Not technically, no, it's open to the public.
Okay.
So we'll have that on February 16th, and then we have a second dose clinic on March 9th. But at this point, there's not a lot of second doses needed because a lot of people are looking for boosters. Some of the 5 to 11s may need their second dose, but so either clinic people can come to, and that information will be posted soon. It's been posted to the school website, and we'll post it out to our on our Facebook tomorrow. After hearing from Megan and from the CDC and the state about better masking, we purchased 1,500 KF94s for adults, and then 500 child-sized ones. So Jackie's been working to get those out.
How's that going, Jackie?
Real well. We had a huge, I think we've done between the adults and kids 1,000 so far, and that's 2-3 weeks. We had a huge surge the first week, was crazy, and then it's slowed down, which is what you expect. And then the Council on Aging was giving some out too.
Oh, good. Good.
Do you still have some child masks left?
Yes.
Mm-hmm.
And if I wanted to come get some, that would be okay?
Yeah.
All right. I may just,
How many do you need?
because, what's that?
How many? I can set them aside. How many do you need?
I mean, whatever you think you can spare.
Okay.
It's for my daughter. She wears N95s every day. So
Okay, I'll put some aside. They'll be at the
Thanks.
office. If I'm not there, somebody is usually there.
thank you.
Yep.
Like Jackie said, we gave some to the Council on Aging, and then we also gave, we still had some KN95s that we got from MEMA back in 2020, and they're not the ones that were recently circulating as not being effective. These are prior, and Jackie did some research on them. We gave those to the community center, the Council on Aging, and then also to the public if they preferred those types. And lastly, rapid tests. We distributed between the mayor's office and the health department. We distributed rapid tests. I don't know if I touched on this at the last meeting, but we identified certain populations, low-income housing, elderly, veterans, city employees, daycares, and we reached out to those entities and we gave them the rapid test to distribute to their populations, which went really well. We were able to secure some more tests, so we're actually doing a distribution with businesses right now. So there's a sign-up form that's been circulating to businesses between my contacts and the Chamber of Commerce contacts.
Great.
So we have a couple pickup sites. There's Bridget, Brian, and I are doing one tomorrow at Millside Park. Comics and More partnered with us. They're doing some on Cottage Street, and then the Chamber of Commerce is going to have a separate pickup site. So that's been going well. And then I just wanted to update you guys that I know Amy mentioned last time about doing paid advertising on Facebook. For some reason, I can't do that. So I just wanted to let you know. So you weren't wondering why I wasn't doing it. But our Facebook is kind of funky, and I tried to do paid advertising and it said it wasn't allowed. So.
Okay.
So that's. Go
I
ahead.
just wanted to ask, how's the Milpan test clinic going?
It's actually, so a couple weeks ago, it was insanely busy. It would be booked out for a week at a time. Now there's plenty of appointments available. So I hope, that Curative wants to stay with us, even though, they're not getting a ton of people anymore. I do believe that they're going to start taking like walk-ins or drive-ins because they can accommodate. And we switched from the first 2 weeks, just while we were kind of getting a taste of everything, we had a police officer directing traffic at the entrance, and we've switched to CERT, which is the Community Emergency Response Team. They're volunteers, and so they've been there every day. So it's been going really well. We'll continue it as long as there's a need. I just don't know if Curative's going to want to continue if we only have like 20 people a day. So we'll kind of keep an eye on it.
Okay. Great. I'm glad it's there.
Mm-hmm.
Yeah.
Jackie, what were you going to say?
The recordings of the meetings, I don't know if you wanted to discuss that or not. Or not.
Oh, yeah, there was someone was looking for the recording of our meeting. Easthampton Media posts them to YouTube. I guess for now, if someone wants a recording, they'll have to ask, I'm assuming Easthampton Media. They tried to post, they post them to their YouTube channel, and I guess YouTube flagged them because there was so much COVID talk, and they said that it was
Oh,
It got flagged for like incorrect COVID information because there was a lot of talk about COVID the last couple of meetings. So if anyone's looking for our meetings, they can either reach out to me or to Easthampton Media, and we'll be able to get them to people.
okay. Good to know. Okay. Wow.
That's interesting.
Yeah.
Yeah. Well,
Okay.
so
All right. I mean, that's pretty much all we had on the agenda, unless Beth or Bridget. I guess Brian's not here.
no, he was out sick today.
I have nothing.
Me neither.
All right, so then I guess I'll make a motion to end the meeting on February 1st, 2022 at 5:52 p.m.
I second that motion. All in favor? Maggie, yes.
Beth, yes.
Meeting is adjourned.
Thank
5:50
you.
p.m. Boy, that was one of the fastest ones yet.
Yeah, less than 20 minutes.
I'll take
Well
it.
done.
Yeah, me too.
Thank you, guys.
All right.
Thank you.
Thank you, Megan. Thanks, everybody.
Thanks, Megan. Bye.
Bye.